my privilege and honor to interview Dr. Robert Singer today for the Plastic Surgery Channel. Dr. Singer, so nice to see you.
Always a pleasure.
Really long friendship we had over the years, and it's nice to be able to chat with you in front of the camera. I have some questions. We know that your expertise extends into cosmetic medicine and all aspects of aesthetic surgery, and you've been extremely instrumental in our societies. And so it's hard to know just what to focus on. But I thought maybe I should ask you first, what are your thoughts about what we hear nowadays a lot in the press, in the electronic and in the written media, is that more is less when it comes to cosmetic treatments and when it comes to aesthetic surgery. Is it more really less, or less is more? Which way do you find this equation to play itself?
One of the things that I've seen with the evolution of procedures is more natural procedures, better procedures. But a lot of that has to do with what I talked about earlier. Individualization, assessing why does that person have aging, and then correcting those elements, whether it's the underlying bony framework, whether it's the tissue underneath, whether the shifting of the fat, putting it where it belongs, or often as we get older, we lose volume. So it's not a matter of just pulling. That's an antiquated concept. Pulling makes that excessive tight look. Excess laser gives that waxy, unnormal look. There's no magic in a bottle. There's no facelift in a bottle. There's no non-surgical facelift. And there are no magical lunchtime facelifts that you'll see advertised as, commercially branded procedures. And the problem with those is they often cut corners.
Cut corners and head into an unsafe direction.
I believe in less invasive procedures. I believe in preventative early treatment. All of those things help, and all of them have a role. But the reality is less is less. I was asked years ago, what's the greatest advancement in aesthetic procedures? And for me, it's not technology. It's not a procedure. It's the fact of good evaluation, individualization. What's good for one person is not the best for someone else. And I think that you hit on something, and that is going to a provider who doesn't have all the tools available, or thinking because it's non-invasive, it's non-medical. But the reality is we're all seeing problems that come from non-core physicians who are inappropriately trained or not trained at all, and they're doing some of these less invasive or non-invasive procedures, but they're still medical, there's still potential problems. So you really need an appropriately trained expert to do all of those things.
You and I both have been proponents of patient safety for a really long time. Would you make a couple of comments about that, please?
Well, you gave me a lot of areas there. Consultation is key, and it was a member of my family. They would have a consultation with a board-certified plastic surgeon, ideally a member of the American Society for Aesthetic Plastic Surgery, because that's the group that focus their practice, have the greatest experience and greatest knowledge on aesthetic options, and they have all of the options.
How do you see the coordinated effort between these different venues to be of benefit to aesthetic surgery?
I think for the public's point of view, it's wonderful that you have different venues like this all carrying an appropriate, valid message. There's so much noise out there, and it's hard for the patients to be able to filter it because there are no filters and guidelines. So the fact that there is the Plastic Surgery Channel, the fact that there is the American Society for Aesthetic Plastic Surgery and the Smart Beauty Guide, other venues like New Beauty Magazine, all of those carry valid messages. I think all of those are excellent resources, and for the public, it helps protect them. It's good for safety. It's good for the specialty of plastic surgery. So I think the more venues like that are available and work cooperatively, carrying the right message, I think is only beneficial. I think that the key thing should always be patient safety.